My name is Jenny Rictaric, and I will be reviewing a controlled trial. I had difficulty deciding on a topic for my PCOT question. I currently work both long-term care and skilled nursing. These are not limited specialties of work, so it was hard to narrow my focus into one question. While working, I noticed we had several patients who would return for rehabilitation and skilled nursing services after only a couple months post-discharge. This was a concern of mine. What could we do better at our facility to decrease the return to hospital rates post-skilled nursing discharge? I decided to ask around about the post-discharge follow-up conducted at my facility. The Social Services Department is in charge of post-discharge follow-up. Social service representatives follow up with the patients who are at a high risk to return to the hospital. The patients who are at a low risk to return to the hospital usually do not receive follow-up. I feel that every patient discharged from the facility should receive some sort of follow-up. I also wonder if post-discharge follow-up was conducted by nurses, if it would make more of a difference in the return to hospital rates. My PCOT question was, for discharged patients from skilled nursing facilities, does 1 to 2 nursing follow-up calls versus 1 social service representative follow-up call decrease the return to hospital encounters within 1 to 2 months post-discharge? At the time I selected my PCOT question, I wasn't really aware of other ways of post-discharge follow-up. The study I chose used a medical appointment before discharge as an intervention to prevent hospital readmissions. Return to hospital rates can be lowered by thorough nursing follow-up at the time of discharge. There is a lot of focus on preventing return to hospitals when patients are staying at the skilled nursing facilities. There doesn't appear to be the same amount of focus on the return to hospital rates post-skilled nursing discharge. For the best interest of the patients, I believe that they are both equally important. Nurse education, patient follow-up, and assessments are key to aiding in a smooth transition to home or long-term care facility. We need to continue to find ways to improve the return to hospital rate post-skilled nursing discharge. According to the Medicare Payment Advisory Commission, there are 11 million or more Medicare hospital discharges per year, with 17.6% hospital readmission rate within 30 days of discharge in 2005. The study being reviewed in this presentation is testing an intervention to decrease return to hospital rates after skilled nursing facility discharge. I feel this article fits my PCOT question well. We all know that return to hospital rates can be lowered due to many different interventions. The intervention being explored in this article was the implementation of a visit to a care clinic staffed with a nurse practitioner immediately before discharge from a skilled nursing facility. The nurse practitioner performed medication reconciliation from hospital to skilled nursing facility to home, ordered appropriate durable medical equipment, provided caregiver education, ordered home health services, and more. In the next couple slides, I will be appraising the study, including deciding on a level of evidence on the pyramid of evidence. The pyramid of evidence ranks the types of research studies. The higher it is on the pyramid means that the studies are more rigorous and allow for less error and bias. I used the search engine Sinal to find my article. The search terms I used were skilled nursing facilities and discharge. Level of evidence is a level 3. A level 3 on the pyramid means evidence obtained from well-designed, controlled trials without randomization. The name of the article is Influence of a Transitional Care Clinic on Subsequent 30-Day Hospitalizations and Emergency Department Visits in Individuals Discharged from Skilled Nursing Facilities, by Park, Branch, Bulot, Vias, and Roever. The study is a controlled trial without randomization. A controlled trial is a research study where one group is assigned the testing variable and the other group is not assigned the testing variable. The study was accomplished using a pre-post design. This means that the evidence was gathered before the testing variable was introduced and more evidence was gathered after the testing variable began. The sample size for the study is 351. The setting is the James Haley Veterans Affairs Hospital in Florida and local skilled nursing facilities. The study was accomplished using retrospective chart review. The control group consisted of patients who were discharged prior to the intervention care clinic. The variable group consisted of patients who participated in the care clinic intervention. There were no reported conduct issues noted in this study. The purpose of the study was to determine if discharge interventions such as the transitional care clinic prior to discharge was needed to decrease the readmission rate to the hospital post-skilled nursing discharge. The trial measures were selected during retrospective chart review. The review team consisted of 3 physicians. Patients who were selected for each group were selected by the physicians to have the following characteristics: risk factors of readmission to the hospital, such as length of stay, number of medications, and comorbidities. The control group consisted of patients who were discharged prior to the intervention of the care clinic. The variable group consisted of patients who participated in the care clinic intervention. The weaknesses of the study include the use of only one discipline for the selection panel and the possibility of subjectivity during the data collection. Using retrospective chart review is almost like doing a study backwards. None of the patients were selected before the intervention was implemented. I believe this type of pre-post design could lead to possible errors in selection of group participants. If not as many participants fall into the categories defined for the study, some patients may have been added to the study who may not belong. The results for the study were positive. The non-intervention group had a return to hospital rate of 23%, while the intervention group had a return to hospital rate of only 14%. There was a notable difference in the rehospitalization rate of the non-intervention group versus the intervention group. I think that it may have been more beneficial to this topic had the difference been greater. When I was searching for similar studies through the databases with my search terms, I did not notice an abundance of study articles specifically talking about skilled nursing discharge. I don't know if it was related to my search terms, but I kept coming across more articles related to return to hospital rates post-hospital discharge. The study conclusion mentions the lack of other studies that have been done on the return to hospital rate post-skilled nursing discharge and suggests that more research needs to be done. This study lends positive ideas to change the current return to hospital rates post-skilled nursing discharge. This study may have its flaws, but it is only a small piece of research that may lead to change. It is up to more research, clinical knowledge, and what is in the best interest of our patients